Welcome to your online training module, Introduction to Medical Entomology. In this unit, we explore the technologies that enhance the efficiency of data collection and support improved data analysis. But first, let's see how Vectorlandia can adjust to new technologies.
Lab results confirm the disease is mosquito-borne. In response, the Vector Control Unit will launch a mosquito surveillance program, including a detailed survey to track species amid recent fever spikes and rainfall. While known vectors are present, environmental changes may introduce new ones. So real-time data sharing through the One Health Committee is being recommended to speed up detection and intervention.
Mobile data entry tools involve using smartphones, tablets, handheld GPS-enabled devices, or any form of technology that can collect, record, and upload research data in digital form and make it accessible in real time. Digital tools are software applications, platforms, or technologies used to collect, process, analyze, store, and share information in a digital form such as ODK, Kobo Tool, ArcGIS. In this unit, we examine three main tools. Those are Mobile Graphic Interface System, Data Collection App, and Data Management Software. GIS tools can help researchers map areas of interest, such as breeding sites, collection sites, or areas for random site selection. Some of the more common GIS software are ArcGIS Field Maps and QField. Data collection apps can be used to collect field data from participants' responses using phones or tablets without the need for internet access. The data is synced once it connects to the internet. Common programs are ODK, ONA, Kobo Toolbox, and ComCare. Data management platforms are used to manage the field data collected in the field. They provide researchers with a real-time data dashboard and data analytics to determine trends and other valuable surveillance data outputs. In order to use GIS software, data collection points need to be collected using Global Positioning System. Global Positioning System, or GPS, is a satellite-based navigation system that provides users with real-time location services. The service is accessible via a GPS device, where it provides users with accurate coordinate points. Researchers can use those GPS points to map out study sites such as marshes or positive cases and use the visual representation of locations for further planning and analysis. Here we have an example of a basic GPS device. It is important to familiarize yourself with the different functions and button options before heading out to the field. Other best practices include the initial setting up of the device, how to get better satellite accuracy, and how to navigate or record your locations. Learning these tools ensure accurate recordings and efficient data management. Global Positioning System, or GPS. Technology plays a critical role in enhancing the precision and efficiency of entomological field surveillance. During field operations, GPS units are used to capture the exact geographic coordinates of areas of great interest. These spatially referenced data form the foundation for subsequent geospatial analysis. Once collected, GPS waypoints and coordinates are exported in a GIS-compatible format, such as CSV, GPX, or shapefiles. Once imported into a GIS software, they can generate and visualize the extent of surveillance activities within the area. Techniques like hotspot analysis enable the identification of areas with elevated ovipositional activity or increased mosquito abundance, thereby highlighting potential high-risk zones. The results of these analyses are synthesized into maps and visual products that illustrate mosquito density patterns, risk gradients, and surveillance coverage. These outputs support evidence-based decision-making for vector monitoring and targeted control interventions. Other helpful digital tools include digital forms. This allows for researchers to digitally collect records and upload in an online data repository, which provides efficient data management, reduction of paper, and automatic time and geolocation tracking. Researchers can also ensure data is kept safe, as the platform can only be accessible by authorized users with the account's username and password. Online digital forms allow researchers to collect field data on phones or tablets, minimizing the use of paper-based forms. The data is uploaded to servers where the data is digitized, making the data more accessible and easier for analysis and to share among other groups. Some platform examples are ONA.io and ODK. For both platforms, researchers can use the mobile data collection platform to build the data collection form, upload the data and have access to real-time data monitoring as data is ingested in the platform. For this unit, we will look at ona.io, one of several online form builders for digital data collection. ona.io provides users with a user-friendly interface to build data collection forms and also allows advanced users to upload an XLS file with their form script. Using the form builder, researchers can design customized data collection instruments by selecting the appropriate response type for each question and configuring rules, validation parameters, and language settings. The form can then be reviewed for accuracy and functionality prior to saving and publishing it for field use. Once the form is published, authorized personnel can download it onto a compatible mobile data collection application. For this demonstration, ODK Collect is used. After entering the required authentication credentials, the user can download the form to the device. Once stored locally, the form can be accessed and completed in the field without an active internet connection, an advantage for surveillance activities conducted in areas with limited or intermittent connectivity. Field staff complete the form and select Finalize to save the collected data on the tablet. The stored submissions can then be uploaded to the data management platform when internet access becomes available. The completed forms are uploaded to the ONA platform, where the data is automatically converted into XML format to facilitate efficient storage and management. Once uploaded, all submissions become accessible through the platform's dashboard, allowing researchers to review individual records or explore aggregated results. The data can be visualized using built-in analytical tools, including charts and graphs, or exported for advanced statistical analysis in external software, or for spatial visualization and mapping in GIS applications. The system enhances spatial data collection by using mobile device GPS to capture precise coordinates, enabling accurate mapping and geotagging for spatial analysis and resource planning. Its offline functionality allows data collectors to access and complete forms without internet connectivity, with entries stored locally and synchronized once a connection is available, ideal for remote field settings. Data is electronically submitted to platforms such as ONA or ODK Collect, where they can be securely stored, visualized in real time, and monitored for project progress and emerging trends. Digital forms with built-in logic and validation improve data accuracy, reduce human error, and streamline analysis, whether conducted within the platform or through export to external tools like Excel or GIS software.
My name is Donovan Leva. I'm currently a graduate student at the University of Notre Dame, doing a master's in global affairs. I did my undergrad in biology at the University of Belize, and prior to coming to the University of Notre Dame, I was the acting manager of the Belize Vector and Ecology Center in Belize. There we conducted research around with insects that transmit disease throughout the country. We were based in Orange Walk in the north of Belize. So we assisted the Ministry of Health on these vector surveillance projects, and also did spatial mapping, insecticide resistance, and community outreach for the local Ministry of Health. Countries might have a hard time because they might not be aware of different options that are available to them for data collection and management. Their systems may be designed to run on the traditional pen and paper model, but time has shown how tedious these tasks can be, not to mention cleaning up the data gathered and the amount of human error that is often encountered. Digital forms, on the other hand, allow for fast and reliable data entry and even management. There are a lot of new applications and software packages, but there may be the need for some guidance as to where and how to make use of these for more efficient outcomes. There may also be concerns about the learning curve, but almost everyone in today's day and age owns a smartphone and knows how to operate it, so it won't be that difficult to adjust to. Depending on the scope of your project, in order to get community members motivated, it is important to create a human-centered approach to insight participation. when entering a community for the first time, you need to be respectful of the customs and the rules of the community and create an environment. Explain your project in a way that is easy to follow, and then stress the impact that their participation would have to the overall improvement of the community or the country. There must also be an appropriate feedback loop where members of the community can voice their concerns and provide important contextual knowledge on your approach. Community members that understand the big picture of the outcome will be more likely to participate and even lead to some aspects in getting others to participate, which could then contribute to long-term sustainability of your project. Indeed, I do believe that it had a greater impact. Mobile data entry gave rise to mobile health applications such as mHealth apps. These can be downloaded on smartphones and even tablets, and they're readily available for people to use, and they are designed to be user friendly, and it creates a path of virtual communication between health centers, health workers, and patients without need for patients to physically go to the hospital to be diagnosed. So patients can enter their symptoms from the convenience of their home, and relevant healthcare providers can then be prompted, and they will be able to determine how to follow up or who will follow up with the patients in a more targeted and efficient manner. Systems like these are currently in place in some countries, and it has been very successful in terms of reducing the amount of cases within a localized area just by being able to act quickly, so that you are able to mitigate the risk of spread of these contagious pathogens.